So I was just scrolling on the Tickety Talk, and I came upon Dr. Shani, and she said something quite interesting. She said that the number one mental illness right now that she's seeing for people are people that think that they have parasites living in their skin. Who does that sound like? Randy Glanville. She is convinced that she has a worm or some sort of parasite in her cheek. If you have seen her recently, she looks extremely thin. And I don't want to say this. How can I say this gently? The energy that I'm picking up from her is, we're close to, and if this is a mental illness, she doesn't need any of the plastic surgeon's help. She needs a psychiatrist and a psychologist and a team of those individuals. But apparently this is one of the hardest conditions to heal because these patients are convinced that they have a parasite or some sort of worm in their face. Oh, what a horrible sickness.
There's a condition called delusional parasitosis, and it is basically a psychiatric diagnosis. It is a delusional disorder that someone believes strongly that they are infected with some sort of infectious species, typically a parasite, but also bugs or bacteria or something else. And it is one of the toughest patient encounters that I've ever had, and I've had a few. I'm sure it's more commonly seen amongst family practice physicians and other providers or PCPs, and also dermatologists, because it's commonly patients presenting with some sort of skin problem where they believe that there's bugs or some other infection there. And all the convincing, all the proof, all the testing completed cannot convince these individuals that they are not infected. It is an exhausting situation, both for the person affected. Imagine living a life where you constantly think that you have some sort of parasite or life-threatening infection of sorts, and doctors are telling you, no, you don't. It's really, really, really tough. And it cannot get better by telling the person you don't have this. And it is really hard because the treatment for it is psychiatric management, which is also a challenge for a psychiatrist to treat it. And the encounters that I've had are typically very long office appointments with follow-up stool tests and other tests that we may do, sometimes even going so far as a colonoscopy or endoscopy to show that they don't have some sort of parasite or other concern. And when those tests are negative, the person feels like I'm lying to them. They don't trust my results in any way.